Hello, everybody. Thanks for joining us today. We're just waiting for our guest, Tara. Hello, Tara.
Hey, good afternoon, Gabe. How are you today?
Good. How about you? Thank you for joining us today, Tara. I appreciate it.
Oh, it's
Just to let
my pleasure. My pleasure.
Great. Just to let everybody know, I am Gabriel Ortiz. I'm a physician assistant. I am also serve as a senior clinical educator with Thermo Fisher Scientific. For today's session, I'm joined by Tara Bruner, my colleague, for today's session, viral. We have certainly many viruses this time of year, right? Colds, flus, viral symptoms overlapping with allergic symptoms. Just want everybody to know that this in no place replaces medical advice. You should always seek your own healthcare provider. We will be talking about different situations today, but in no means should be taken as medical advice. So thank you, Tara, for joining me today on our session. If you wouldn't mind introducing yourself and tell everybody where you work.
Absolutely. So it's a pleasure to be with you, Gabe. Gabe is my colleague. I am a clinical educator with Thermo Fisher Scientific, and we work in the realm of autoimmune and allergy diseases. Really, how can we better diagnostically and accurately take care of patients with those diseases? And so I'm also a PA. So I've been a physician assistant for about 17 years and still practice some in the primary care setting. So I still kind of get the best of both worlds. So yeah, so it's exciting to be able to talk about today really what everybody's dealing with. Everybody's dealing with the sniffles and the crud and trying to figure out what is it.
Right. This time of year, a lot of overlapping symptoms, right? We get patients maybe with a lot of runny nose, nasal congestion, maybe even some itchy, watery eyes, cough, certainly some symptoms that can actually even get worse, right? So have you seen maybe a patient like this, Tara, in your clinical practice, or a patient that you can think about?
Yeah, I was working a couple of weeks ago and it was back to back, all sinus crud problems, cough and sinuses, and is it allergies? And patients come to us when they've exhausted. Okay, I've tried the antihistamines, I've tried to take care of this myself, and so they're coming to us, the provider, to find out, what is it? How do I need to treat this? Do I need an antibiotic? Do I need steroids? Is it allergies? Is it something worse? We're in this day and age of, well, we have to rule out COVID first. Luckily, we're kind of hopefully on the tail end of that. But again, each one of these things, whether it's virus, allergy, bacteria, causing these symptoms that you're having, they need to have some kind of diagnosis to treat appropriately. Does it need a prescription or not? And so what I like to tell patients is, yeah, we're going to take care of that today, but let's try to figure out what it is. So we have tests, we have the rapid test for COVID. We also have some testing for viruses. We can find out, we can test, even do x-rays or certain things to see if it's bacterial. But what I want to talk about today, kind of what we do is talk about, okay, is this allergy? And you mentioned overlap, okay? Sometimes when we have allergies, what we're talking about is inflammation of the airway, whether it's lower airway where we're coughing, or if it's inflammation of our sinuses or our nose, etc. And so I want to talk a little bit about that. There's a simple blood test that your provider can do to test for allergies. And I think that that's something that's very important to know, because if we have allergies, we can treat that, but we can also calm down that inflammation so this doesn't happen every spring and fall. So that's what I try to offer patients.
Yeah, good point. You mentioned something like, right, let's name it. Let's find out what it is. Let's find out, is it influenza A, influenza B, COVID, right. Maybe, right? All of those viruses that I think most of the country is having to deal with, right? And then perfect timing when it may be overlapping with maybe some of those seasonal allergies. I was talking to a provider yesterday who actually said, you know what, kind of didn't really think about, but tree season, right? This is prime tree season for a lot of the country. And I know very early on when I was in allergy practice, we would have many patients that would, over the winter season, right, not realize that it is prime tree season overlapping with the viruses, right?
Yeah,
So
you're exactly right.
being able to identify, right? And you bring up another good point, Tara, talking about, right, if it's seasonality, right? Being able to identify, so maybe minimize some of those symptoms year after year after year, recognizing what those allergens might be. But is there a particular case, Tara, that you feel fits with this discussion?
I've got to tell you one of my personal, so I'm also a mother. And I'm a provider, and there are many providers out there that don't understand that there's a simple blood test. So typically when we're talking about allergies, we think, okay, I've got to see an allergist and do the skin prick, which is very valuable, absolutely valuable. But, not all of us can get to the allergist in a timely manner, or have the time to take off work. And so there is a simple blood test it's just as simple as, anytime you go get your blood drawn from your provider and you get these results for allergy. Okay, is it indoor allergens? Is it outdoor allergens? I was not very well versed in that. About 8 years ago, actually it was probably a little earlier than that, my daughter she had some rashes when she was little, and then she had what we call reactive airway. And I laid awake at night just listening to her wheeze and cough, thinking, oh, great, we're going to have asthma. We had all these, flare-ups. We got a cold. She got pneumonia. It was just exacerbated for her. So the pediatrician says, let's go get, allergy testing. And she's 4 years old, so I have to hold her down. Well, first of all, she exacerbated. You have to come off your antihistamines. I took her off her antihistamines. We had to reschedule that appointment twice. Finally, I'm holding her down. She has those pricks on her back. They're starting to light up. They're getting red and angry. We're all miserable for 20 minutes. And come to find out, we know that her symptoms are allergic. She's atopic is the term that we use. And I was able to determine then, her season really bad is going to be spring and fall because of the outdoor allergens. Mm-hmm. We were also understood what was her indoor allergens so that we could manage those. And you know what? It was valuable information because we were able to take that information. Now, she was still doing an inhaler because she was too young to do pulmonary function tests. And we continued with the inhaler. We tried to reduce her exposure to those allergens. And then it was about 3 years later, she had the pulmonary function test. And I thought for sure, we're going to have asthma. We're going to have, we're going to have to carry an inhaler everywhere we go. And we did the pulmonary function test, and the allergist looks at me and he said, she doesn't have asthma. It's all in her sinuses. So, she was just accumulating this inflammation. So we were able to clear that out pretty good with a long antibiotic, cleared that out. And now she's almost 16. She's going to love it that I'm telling this story. But we just treat her seasonally. We know, okay, so right now she's doing her nasal steroids. She's doing her antihistamines because we gave it a name. We know what her allergies are. She's really reactive to viruses. So we try to stay on top of that. So I didn't know there was a blood test. Boy, howdy, if I could go back and do in time and say, you know what, neither one of those are great for a 4-year-old blood draw versus a skin prick, but I would go back and choose a blood draw for sure. Absolutely. So that one was one where I thought, man, this needs to be said out in primary care so that patients know, I can find this out in a simple blood draw.
Right. You bring up a good point, right? Early on, being able to name it. And then you spoke about, identifying what the trigger is. So one of the best things that we can do for perennial allergens, right, is to try to minimize exposure and alleviate those triggers. But seasonally, right, we're not going to keep people in a bubble.
Yeah, you're right.
And being able to identify those triggers, knowing what those seasons are, right, the pollinating seasons are, initiating medication prior to the season. So I often say a big advantage of identifying your triggers, right, to be able to enjoy the outdoors, go out. We don't want to keep you, again, in a bubble, right, is what we call priming, right, starting medication prior to the season so that you have the medication already in a good steady state in your system to help minimize those symptoms. And when we talk about, those overlapping symptoms, it can become pretty difficult, right?
Absolutely. I mean, goodness. So let's just give one more story. As a mom, my son has that gunky nose at age, 4. And I'm like, I don't like asking for antibiotics and things like that. So he had the blood test. It was simple, easy, and it was simple dust mites, the things that live in our mattresses or pillows. It's just their extra skin. I mean, I hate to say it, they're everywhere. So we just put a simple dust mite cover on his bed and his pillow. We do some simple things around the house. We haven't needed an antibiotic, and now he's almost 13. So I see the value in this, and I see it day in and day with my patients when I say, I see that you come in here every spring and every fall when things get really bad and you need an antibiotic or you need a steroid. Let's try to reduce that by finding out what your triggers are. Let's name it. I felt overwhelmed when I had my daughter filling out paper. We were filling out paper and it was asking, do you have carpets in your house? Do you have a HEPA filter? And I thought, well, I've got to pull up all the carpet in my house. Think of the cost that would be, and that wouldn't have done any good for her results. So again, if we name it, we can target that. So that's the beauty, I think. Again, we're in the middle of the season of, well, do I need an antihistamine? Or do I need something else? And so again, we can help with that. We can rule in the allergies and say, this is how you have to do it. Or we can say, you know what? This isn't allergy at all. You don't need that antihistamine. It's not going to help. We need to figure out the other reason for your symptoms.
Yeah, good point. You bring up two really good points, right? Most people think that every runny nose is allergic. So even though very easy to obtain, right? A lot of antihistamines over the counter. Many people may not know which ones to get, right? We would hope that they not go over the counter and just take, oh, I've heard of Benadryl. I know Benadryl. It's relatively cheap. Take Benadryl and go out and drive, which can make you drowsy and not it, right? So you bring up a good point, right? Antihistamines not approved for non-allergic rhinitis. So one point. The other point is, being able to take appropriate medication. But you also brought up a very good point about exposure reduction. Can you talk about maybe some of those exposure reduction measures you got into, for example, pillow and mattress encasings, some things you find work?
Yeah, so we see a lot for triggers for rhinitis, but especially asthma, house dust mites. It's not the dust that you're going to see on your windowsill. It's not that you're not clean. It's just these organisms that live in our, they actually like the humidity and they feed off of our dead skin cells. It's kind of a gross topic, but it's kind of interesting. We all have them. They're not the bed bugs that everybody is fearful of, but they actually have this skeleton, and the skeleton has a protein in it. And that can actually come in, up and out of the mattress, the encasing. So that has properties that cause allergy for certain people who are sensitized to it. So what do we do for that? It's actually just as simple as a simple dust mite cover. So this dust mite cover, the weave of this dust mite cover is a lot tighter so that those things can't come back and forth. And you zip it around the mattress. And typically it's one and done. You don't take that off to wash it. You only take it if it's soiled or if it's ripped. And you're able just to do that for your pillow as well and the mattress. Then what I recommend, and allergists recommend, to wash your sheets in really hot water. If you can, keep the stuffed animals off the bed, extra things that might have some of those in there. Now, if you have little bitties, I've even heard you can put your lovey or a little lamb or something that the kid likes, either wash it in hot water or put it in the dryer with high heat. Or you can even put it in the freezer. That kind of deactivates some of that. So there are some simple tools that actually, you do that once a week. I've seen this work for patients coming in with chronic sinusitis. Okay. Mm-hmm. They haven't had problems. They haven't had antibiotics. And I saw that true with my son. So when you're able to understand what is exactly your trigger, then okay, I got this. I can do something about this.
Yeah, that's good. Good mention of some of those. I know some of the other ones that I have always talked about and recommend is a lot of people, especially during the seasonal allergens, right? If they're sensitized and maybe have symptoms with the seasonal allergens, they go outside during that time of year. Very simple thing to keep in mind is to shower off before you go to bed, because we accumulate all that on our hair. Wash your eyebrows, your eyelashes, be real good about getting that pollen off of your hair, as opposed to if you lay down at night, you're sleeping, breathing it in all night. So very simple things to do. What about pets, Tara? Are any recommendations that you have about indoor pets?
I mean, listen, let's be honest. None of us want to get rid of our pet. They're a member of the family. And so when you say, it's probably your dog, get rid of your dog, and then you find out later it wasn't your dog, I mean, I would be quite upset. So we can test for dog dander. Now, many say, well, I have a hypoallergenic dog. Well, they all have skin. They all have dander, let's just be honest. But some shed that more than others. So not truly hypoallergenic, but some may shed their dander less. And so if we think about that, again, let's keep the bedroom a safe room. Let's not let the dog go into that bedroom where that person who has that allergy go in there. Just try to minimize that. If you can, wash your dog twice a week. Try to reduce that dander buildup. And so very easy tools, I'll say. And you were mentioning outdoor allergens. Many say, well, that's not gonna, I can't fix that. One thing that I heard this coined phrase that I really liked from a colleague. And Doug, if you're listening, this is yours, but it's don't make an outdoor allergy an indoor allergy. Meaning, so don't open your window on a beautiful spring day, letting all those pollens just come on in. Or if you're driving down the highway and you want to open your window and you know your kiddo's allergic to outdoor allergens, let's just not do that. And so I really liked that term, is don't make an outdoor. So when you come in, try to get those pollens off, either shower, take care, change your clothes. And those are just some simple tools that I have seen where patients came in, urgent care visit, often saying that antibiotic didn't work. I think your symptoms are still there because of allergies, and testing for that. And then they come back and I don't see them as much, but that means that they are doing well. So I like to see that. But yeah, it's very simple to try to reduce your exposure. I'm not saying, or we don't even say, there may be times where you need shots, immunotherapy shots, where they try to get your body used to those allergens. We're not speaking against that. We just know that, if somebody's diabetic, you're not going to give them, medicine without talking to them about diet and exercise. We're kind of talking to the same thing as, okay, what is your allergen? What are you sensitized to? Let's try to reduce your exposure and then treat with medications, like you said. Either they work or they don't work, or they have side effects. So this is just kind of a conservative approach to be able to take care of the environment.
Yes, I like what you say about don't make the outdoors indoor, right? So a couple of points on that. We talked about showering to get the pollen off of your hair, eyebrows, eyelashes, but also on windy days it carries more pollen. And during in my part of the country, April is the windiest month. So we're coming into the windiest month, had like 55-mile-an-hour winds. And so it's not the wind that's causing the problem, it's what's carried in the wind. So all of our pollen, and that just happens to correlate with our predominant tree pollinating right now, right? So we accumulate all of that on our clothing as well. So you made a good point. You come in the house, if you know you have that pollen, maybe drop it off before you carry that pollen clothes into your bedroom. So into the washer right there. Another good point is we talked about the dog, right? Not allowing the dog, washing the dog, maybe get rid of some of that pollen. So by testing, you would be able to identify, is it the dog, or maybe is it the grass and weed? So when many patients may not understand, the dog goes outside during the grass, weed, and tree season, gets all that pollen on their hair, then comes inside, maybe comes in the house, maybe in the bedroom, maybe on the bed, just adding more seasonal pollens on the bed. So washing the dog, good idea, right? Taking care of that. But also, as you has said before, right? Don't let the dog in the bedroom. Just as you go in and out, close the door, don't the dog in the bedroom. So one way to start, right, as you mentioned, we don't recommend taking the carpet out anymore. But if you're getting to that point, you've found that, hey, you know what, maybe not the dog, maybe it's a seasonal allergens, is close that door and clean that bedroom well. Vacuum if there's carpeting, take care of the dust mites in the stuffed animals, as you mentioned as well. But any other steps that you think might help these people, Tara, to be able to minimize symptoms, especially if they overlap maybe those viral type symptoms with those allergic symptoms as well?
Well, I think if you do think you have allergies, it's valuable information to know which triggers you have. And when you calm down the inflammation from the allergen, maybe your airway or, all of the lining of your airway isn't so irritable and inflamed that those viruses that come along are worse. So, really, when we talk about trying to reduce allergens, is really trying to reduce inflammation. Now, Gabe, if it's okay, we're running close on time, but we do have a question, and we want to encourage questions in the chat. So there's a question about, are there foods during allergy season that can trigger symptoms? So many of us want to know, how do indoor allergens affect with food allergens? So I'm going to ask you that question. How do those two kind of line up when we're talking about respiratory illness?
Well, we do know, for example, there are some foods that have cross reactivities, right? So, for example, we know that peanut cross reacts with birch pollen. Birch pollen is very common tree, right? In a lot of the U.S. Countryside. So when you have that sensitization to birch pollen and you're getting exposed during the birch pollen season, right? Yeah. And you ingest peanut, it's possible to be symptomatic, right? You may have that runny nose, you may have that cough, you may have those symptoms as well. So foods tend to cause a lot of GI problems, right? Because you ingest them into the stomach, you may be causing symptoms that you may not think are as common as respiratory, right? A lot of symptoms. But how about you, Tara? Any experience with foods that?
Let's just go back to my daughter. So she had that rash when she was a kiddo, and it always happened, this cause and effect with milk. So I took her off milk, and I thought when we got tested, okay, good, we're going to find out if it's milk contributing to this. It was not milk. It was the soy that I was supplementing her with. So again, Mom of the Year award. As a practitioner, I thought, oh my goodness, I don't understand allergies, but really they are quite simple. So if you were talking, okay, I know I get this runny nose, these itchy eyes. Typically, we don't test for foods. The majority of those are going to be caused by what you said, outdoor allergens. We'll be able to test for that. So typically, if we're talking about this, I don't test for foods. The only reason that we do offer blood testing for foods, but typically only in the instance when there is I know I ate this and I had these symptoms. So you have to have exposure. You have to have a clinical response. Really, we want to make sure you don't have anaphylaxis, but you have to have a reason to test for foods. But that's more in the realm of a comprehensive workup. So when we're talking today about viruses and allergies, this time of year, it's usually always a respiratory allergen that's the trigger.
Yeah, good point. Well, Tara, again, thank you for joining us. Any closing arguments, closing comments?
Arguments. No, but I do want to say, Allergy Insider, this is the host of today. Allergy Insider, you can go to you can follow them on Instagram, you can follow them on Facebook. You can also go to the web and see there's information there for healthcare providers. So if you ever go into your healthcare provider and say, I heard about this blood allergy test, many may say, I don't know what you're talking about. Yeah. Then you can say, okay, this is what it is, and you can pull that up. There's also a side for patients. Okay, this is what you're talking about. This is some of the information that y'all discussed about pollens or dust mites. Gives a lot of information on what we're looking for as providers, but what you can do as a patient to reduce your symptoms and have a better quality of life. So if you have any questions, we will continue to monitor this chat. We appreciate you all joining. It was a good conversation. I hope you have a safe and healthy springtime. But again, it was great to talk to you, Gabe. And if you have anything to say, I think we'll close out, but it's been a delightful conversation with you today.
Yes, thank you, Tara. Thank you for joining us. I appreciate your comments and sharing your stories. Extremely valuable when we look at, as we're talking about this time, the overlapping symptoms with viral causes versus allergic causes. And just like to reiterate Tara's point about being able to name it, right? Give it a name.
Right.
You can certainly test to find out what your allergic triggers are. And again, like to say, a lot of valuable information on that Allergy Insider website.
All right.
Thank you.
Well, thank you. It's been great. Take care.
Thank you, Tara. Bye-bye.
Bye-bye.
Stay safe.
You too.